Hi there, this is Dr. Firnhaber, and it's Wednesday, time for 10 Minutes of Truth. So today I have three articles that I want to cover that I think are relevant to our culture and just relevant to humanity in general. The first one is from the Journal of Orthopedic Surgery and Research. This is May of 2023, so it's a year ago. The name of the article is The Effect of Omega-3 Polyunsaturated Fatty Acid Supplementation for Patients with Osteoarthritis, a meta-analysis. So the article looks at 9 randomized controlled trials with a total of 2,000 patients. And they were looking to see, does taking omega-3 fatty acids reduce the pain, inflammation, and progression of osteoarthritis? And the article starts out saying that osteoarthritis is the most common degenerative joint disease in the world that affects cartilage. And, I see it all the time in my practice. It's a leading cause of disability, particularly in the older population. So the problem is how do we deal with this issue in older adults, say 65 and older? Because we know that a lot of the over-the-counter drugs and the prescribed medications have serious side effects when taken long-term. So we know that you take these drugs, even Tylenol, ibuprofen, the celecoxibs, you take those long-term, and they have some profound side effects that are not good, like stomach bleeding, heart attack risk, hormonal changes, liver, kidney damage, all kinds of things. So this article is studying, is there an alternative, a natural alternative, a safer alternative to reducing the pain and inflammation and progression of osteoarthritis? And the fact is what they found is omega-3 fatty acids work pretty darn well. It said pooled results show that omega-3 fatty acid supplementation could significantly relieve arthritis pain as compared to the placebo. And the good thing about this is there aren't any adverse side effects. It improves joint function as well as relieving pain. It's safe and effective. And it says the optimal dose and treatment of the omega-3 fatty acids remains yet to be determined. So here's what I'm going to say about that. I would say 4 to 5 grams a day and split it up during the day. That's how I would start with that. At least 4 grams, probably 5. This is going to help a lot of other areas too. It's going to help brain function. It's going to reduce overall inflammation in the body. It's going to help heart function, all kinds of things. So this is a really, really good alternative to taking drugs, to taking pharmaceuticals or over-the-counter drugs. So omega-3 fatty acids for osteoarthritis, this meta-analysis seems to indicate that it works pretty well. Okay, the next 2 articles are out of the same journal, about a year apart. The name of the journal is called, 2 years apart. The name of the journal is called Nutrients. And this is about vitamin D, and the magnesium-calcium ratio in COVID. So the first one was put out in 2020, which is when it's November of 2020, when, the whole COVID epidemic was just starting to reach its crescendo. And it says this, it says, evidence from observational studies is accumulating, suggesting that the majority of deaths due to SARS-CoV infections are statistically attributable to vitamin D deficiency and could be potentially prevented by vitamin D supplementation. In this study, 87% of COVID-19 deaths may be statistically attributed to vitamin D insufficiency and could be potentially avoided by eliminating vitamin D insufficiency. It says, other population-wide measurements of prevention, widespread vitamin D3 supplementation, at least for high-risk groups such as older adults or people with relevant comorbidity, which has been proven by randomized controlled trials to be beneficial with respect to prevention of other acute respiratory infections and acute exacerbation of asthma and chronic pulmonary disease, should be promoted. So in this article, this is in August of 2022, this article shows that magnesium to calcium ratio is very, very important in COVID-19. Now, we know that magnesium is important for vitamin D activation. So if you're low in magnesium, the vitamin D that you have is not going to be nearly as effective for doing what it's supposed to do. But here, they showed in this article, they looked at laboratory data of over 1,000 patients, average age of 60 years. And the study subjects in this study were people that were hospitalized because of COVID-19. Not necessarily with COVID-19, but because of COVID-19. And what they found was that these people had the people that died had an abnormally low magnesium to calcium ratio. Now this ratio, a typical ratio would be 0.2. In this study, the people that died were all below 0.2. And it said men and women who died had a higher serum calcium level. Men and women who recovered had a higher serum magnesium level. In the whole population, as well as in women and men, the magnesium to calcium ratio was inversely correlated with discharge per death, meaning that the people that came in that had a higher magnesium to calcium ratio usually survived. And the ones that didn't, a lot of times those patients died. It says here, in the treatment for COVID-19, restoring magnesium-calcium balance is mandatory. Findings emphasizes that the important role that the magnesium-calcium balance may play in the prognosis of COVID-19. So we need magnesium. And if you're wondering if you're low in magnesium, taking a whole blood magnesium test would be the most accurate way to look at it, not serum magnesium, but blood magnesium. And so you can just take magnesium and that's fine. The worst thing that can happen is diarrhea. So if you're taking too much magnesium and you start getting diarrhea, you know your body probably reached its limit on what you're able to handle. But magnesium is incredibly important in about 300 different enzyme reactions in the body. It's important for activating vitamin D. And in this study, high magnesium levels determined whether somebody would live or die from COVID that was hospitalized. So these are 3 articles that I think offer some very practical and advice that doesn't cost a lot to implement. So if you have osteoarthritis pain, omega-3 fatty acids have a good chance of helping. If you have vitamin D deficiency, you need to get it up. And you need to take magnesium with it as well for it to work better. So that's all I have for today. This is Dr. Paul Firnhaber at Lincoln Disc and Nutrition in Lincoln, Nebraska. Our phone number is 402-488-2220. And if you have any questions about anything that we do, you can call our office and Carmen would be happy to help you. We'll see you next week. Okay, good.